Commission, and I am happy to call this third quarterly meeting of our commission to order. I wish everybody happy holidays, and I am going to jump right into the business we have before us today. Do we know whether we've got a quorum to be able to approve minutes?
No, we don't. We don't have
Okay.
one.
All right. Well, we will set that aside then for next time. If everybody can, between now and the next time we meet, and we may call a special meeting because we do need to get approval of our legislative agenda. I'm jumping ahead of myself a little bit, but go ahead and be taking a look at those minutes, commission members, so that we can take care of that vote whenever we meet again as well. So I will turn it over to, I'm sorry. That may have just been somebody unmuted. So I'm going to move next into getting the conference report. We had a fabulous conference. It was the first one that I was able to attend in person, and there was a lot of excitement about it. Let's move over to Ms. Ferrell to get a report about that.
Okay, thank you, Judge Whitaker. So again, we did have a very successful conference. It was September the 25th through the 28th in Athens, Georgia. Our theme was the moving forward, achieving, widening the lens, and inclusive response to family violence. I'm sorry, I was reading something else. Our conference co-chairs was Lisa Dawson and Charles Ferrell. They did an amazing job. We had some phenomenal keynote speakers. Sergeant Michael Crumrine of the Austin Police Department. He discussed the law enforcement response to DV as it relates to the LGBTQ+ community. Adam Dodge is he was the next keynote speaker for day 2, and he is the founder of NTAB, and that stands for End Technology Enabled Abuse. And he discussed domestic and sexual violence in the digital age. And a lot of you really enjoyed him. So I know we'll probably be seeing him a lot in Georgia. He made a lot of connections while he was here. And Dr. Tommy Snow, who is a licensed therapist and FIP facilitator. And Dr. Snow discussed his experience with DV and his involvement in the faith community. So he is also a survivor. We had 630 people attend the conference. So even though this was our first conference back in person after the pandemic, we definitely exceeded our numbers. Just to give you a few highlights for those who did not attend the conference, on I think it was Monday, we had University of Georgia's mascot, Harry Dog, made a guest appearance, and he took photos with conference attendees during lunch. So everybody was excited to take pictures with Harry Dog. We did a donation drive, and where conference attendees brought in items for a domestic violence shelter. So it was toiletry items or gift cards. And it was such a huge success. And we had so many items that we were able to give to 2 shelters instead of just one like we originally thought. So all the programs present had an opportunity to place their name in a drawing, and we selected 2 programs. So it was so much stuff. We were able to divide everything equally amongst 2 programs. So that was a huge success. And we also had a happy hour that everybody enjoyed. So that was also a great success. So I would say, even though we were all about the business in Athens, we did have some fun activities. We would also like to thank, of course, CJCC for providing scholarships to DV advocates, sexual assault advocates, first responders, and community partners and DFACS employees. The Judicial Council of Administrative Office of the Courts, we would like to thank them for providing scholarships for judges. Department of Community Supervision, they provided scholarships for DCS officers to attend. And even though FIPs always feel left out, GCFV, actually, we provided, this is the second year we've done it, we provided scholarships for FIP providers and facilitators in training to attend the conference. So overall, we had about 340 scholarships awarded for attendees at the conference. Our conference award recipients for this year, the Gender Justice Award went to Christy Carter with the Criminal Justice Coordinating Council. The task force of the year was Gwinnett County Family Violence Task Force. The task force member of the year was Victoria Dunstan, and she's a member of the Dawson County Domestic Violence Task Force, as well as the Lumpkin County Domestic Violence Task Force. The Moving the Work Forward Award went to, we had 2 recipients of that award, the Georgia TPO Forum and the Georgia Bureau of Investigation CJIS operations team. And our responsible coverage award went to Dee Griffin, and she's a reporter at WJBF News Channel 6 in Augusta, Georgia. So we are also already in the planning phase for 2023 conference, and that conference will be in Jekyll Island, September the 17th through the 20th. And the theme of that conference is evolving responses, what communities can do to reduce family violence. We currently have a request for proposals out. So if you're interested in presenting at our conference next year, please, we have it listed on our website and we've sent it out in emails, the proposal form. So we're accepting proposals until February the 17th. So that's all for that. And just to give you a few of the evaluation results from the conference, just to give you an overview of how we did, even though we had 630 or so attendees, only 384 attendees completed the evaluation. So for those who may be on the call and went and didn't complete the evaluations and then contact me later asking about certificates, you had to complete the evaluation to get the link for the certificate. So just FYI moving forward. So we had about, just to give you an overview of some of the questions, it was on a scale of 1 to 5. Providing you with a new perspective on the work you do, we got a 4.57. Helping you gain a greater understanding of the point of view of survivors of domestic violence, we received a 4.63. Providing good information about best practices for dealing with domestic violence, we received a 4.59. Are we recording? Sorry.
Recording in progress.
And providing insight into working with underserved populations, we received a 4.61. Providing new ideas for working with domestic violence victims and or perpetrators, we received a 4.6. Helping you to meet other organizations or individuals who work with victims of perpetrators, we received a 4.66. So the top responses for the speakers, we received a 4.79. Topics of discussion of 4.65. And for the overall conference, we received a 4.71. So that's not bad on a scale of 1 to 5. The top 5 responses to the following questions. What new information did you learn from this conference? The top 5 answers was technology abuse, domestic violence and sexual assault in the LGBTQ community, DV and faith community, male victims of domestic violence, skin color trauma. What topics would you like to see discussed at future conferences? The first of the top 5 were abortion and DV and sexual assault, women and teen domestic violence offenders, housing for victims, working with immigrant victims, and more content for FIPs and judges. So when we see that about more content for FIPs and judges, if you're on this call today and you might have an idea for a workshop, you can submit a proposal, or you can just email me and say, this is an idea that I have, or if you know of a good speaker that maybe we can reach out to that can address some of the topics that you might be interested in, that would be very helpful. What aspect of this conference was most valuable to you? And the top 5 answers were: number 1, networking; number 2, the keynote speakers; number 3, diverse topics, technology abuse, male DV victims, and LGBTQ plus and faith-based. The conference was in person, so that was most valuable. I guess people were tired of the virtual conferences. And new perspectives. And what aspect of this conference was least valuable to you? These were the top 5 answers. So number 1 was the food. A lot of people were not happy with the food choices. Number 2, not having clear directions on workshop locations, the scavenger hunt, the venue, and the ability to attend workshops that were pre-selected due to room capacity limit. So we hear you, and next year we're going to work to get all of those issues corrected. So April, did you want to add anything to the conference report?
Yes, thank you, Jamila. It was an excellent conference for those who attended. I'm sure you agree. It was a good comeback after 2 years away. I do want to bring something to everyone's attention. We've now been doing this conference for nearly 3 decades. We're coming very, very close to our 30-year anniversary for this conference. And we have not had a fee increase or a change in the conference registration rates in, I believe, Jamila, well over 10 years. And some of the feedback that we've tended to get in the last few years has been similar. And some of that, I can tell you for sure, is a direct product of expenses. It's not cheap to put these conferences on. And we certainly, as a team, as GCFV, we certainly are committed to having the most, giving you all the best experience, the most quality that we can. So we have had a lot of discussion about this over the last several years, and we decided to postpone it most recently because of the pandemic. But as of next year, we are evaluating a fee increase for the registration. We will be having discussions as to what is the appropriate amount of increase. If you look across the nation at similar conferences to ours, many of those conferences are well over $500 or more to register. Certainly not proposing anything at that extreme for us, but certainly if we, and to be honest with you, what we hear when we have out-of-state visitors come to our conferences, that our conferences, as many times they much better in terms of content than what they're seeing at some of even the national DV conferences. So we are putting on superior quality considering our what we've been working on in terms of budget. So I do want to give people a heads up. I don't like people to be surprised when it's time to register and it's like, wait, that's not the amount. But I want to put that out there that we will be sending out a save the date soon. It will include the new registration fees, so you're prepared in advance. But I wanted to give the announcement today so that everyone is aware that that's something we are preparing to do for the 2023 conference. Thank you, Jamila.
All right, and thank you both. And Director Ross, I believe you're also going to be giving us the legislative committee update.
Absolutely. So as Judge Whitaker has already pointed out, we're not going to be conducting business today in terms of selecting or voting on our legislative priorities for the next session. We also, at some point, we have several partners that tend to ask for our endorsement of their policy items. I believe GCADV is on the call today and wanted to at least present theirs. I'll give them an opportunity to do that when I finish our initial update on the legislative agenda. So I'll start with the legislative roundtable. On the Wednesday following Thanksgiving, November 30th, we held the policy roundtable. It was the largest and most well-attended roundtable we've had, at least as long as I've been here, perhaps beyond that. We had nearly 100 attendees. It was a very robust conversation. We had some great ideas that some that weren't even on our radar and some that will take time, but may not be something we pursue in the current session, but certainly something that we would look to pursue over the years coming and maybe work on, in the off session. And I'm sorry, my computer's, I hope I'm not having any connectivity issues. My screen just blacked out for a second. But anyway, so there was a lot of great discussion about some items that may come up in this session and then some that may take longer to work on. But certainly we're going to be following up with all of the partners who had ideas and issues that they brought up in the roundtable. The next thing I want to point out, I know that in September and during the legislative report, there were a couple of items that were put forward that GCFV is currently actively pursuing in terms of working on to develop and prepare for the session. One of those is the firearms legislation. It also, including the boyfriend loophole issue, the working to close or include dating partner relationships and improve firearm restrictions under the laws in Georgia, so that people who are have a protective order against a partner or have a DV related conviction or partner with a DV related conviction that person would then be prohibited from being in possession of firearms. We've put together a legislative packet. We've been working collaboratively with the YWCA and preparing for the legislative session. We've already had several conversations with some legislators between us and the YWCA team. We've had some conversations that have been promising. The early indication is that there's some bipartisan support on this. We know that we've been there before, though, and that this is not an easy issue in our state. We certainly believe wholeheartedly in it, though, that it is an important issue and that it is one that will save lives in Georgia. So we, regardless of it being a challenge, we are ready to pursue it again. The other issue that we are actively working on this year is the Georgia's HIV testing requirement statute. And again, this was mentioned out, so I'll briefly just remind you that this is the bill where if there is a sexual assault that involves some potential of exchange of bodily fluid, a victim can request that the defendant be HIV tested and that the victim be given those results. And so that's already in place. But what we're looking to do is change Georgia's law to bring it more in alignment with a federal law, which requires that be done within 48 hours once it's requested by the victim and the person has been indicted. The reason we're pursuing this is, one, I think it's something that it's a law that certainly could be more victim centered, and so it's an important change. But in addition to that, it was brought to our attention that Georgia is subject to a 5% withholding for certain OVW grant programs because there is a condition to the grant applications that your state law on this issue, on the HIV testing requirement, has to be that the testing is done within 48 hours and that there is an appropriate procedure for follow-up testing if it's required or medically appropriate. So Georgia's law does not technically comply with that and so forth. So for that reason, any Georgia entity, state agency, local organization, whoever who applies for a grant program that has that condition would essentially be forfeiting 5% of that award. That could amount to tens of thousands of dollars that could be helping folks in your programs. And so we don't think that's money we want to forego as a state for a simple issue. We've had some preliminary conversations with the governor's legislative advisors, and they are supportive of this change. We've also had preliminary discussions with some of the legislators on the commission, Senator Strickland, and we've reached out to a couple of others. So we have initial support, and we're going to continue to work this one to try to move forward. This will be the one of the two, as Judge Whitaker mentioned, that I send out for us to vote on our legislative priorities this year. There were several others, again, that I mentioned briefly were brought up during our roundtable by our partners. So these aren't ones that GCFV either initiated or is currently working on, but these are ones that will be endorsed or be requested to see if you all would endorse. I'm not going to run through that whole list right now, but because especially since we're not doing business, what I will do is prepare a legislative report for the commission that will be sent out. And as Judge Whitaker indicated, we'll either do a special called meeting to just vote, just commission members coming on to vote, and no other business will be conducted. It'll be a very quick meeting, or if our bylaws don't prohibit it, we could perhaps do some version of an online poll or vote. But I'll work on finding that out, and you'll be receiving something, because our next meeting won't be until March. We will definitely need to make that decision before then, because we'll be well into the session by March. So that concludes my report on the legislative committee.
All right, thank you, Director Ross. And I also just want to announce to everybody, there's always public comment at the end of these meetings. And if you are interested in making public comment, there is a link to a form for public comment that is in the chat. You'll be able to find it there. So if you are interested in public comment, if you can please go ahead and fill out that form. And then I'm going to turn it back over to Director Ross to introduce our community spotlight speaker.
So closing us out this year, I hope y'all ain't getting tired of my voice. I'm looking. All right, just keep it rolling. Anyway, so wrapping up our year, what I thought would be a great way to do a spotlight was to allow our data analyst and our fatality review coordinator to bring you guys a summary of the family violence by the numbers presentation that they put on at the conference. Unfortunately, our fatality review coordinator yesterday let us know that she's been She's been diagnosed with, not diagnosed, but she's come down and she is not feeling well right now. So she is at home recovering. And we hope she'll be back up and alert and ready by next week. However, that now kicks it to our data analyst, this Summer Abdelmageed. She's excellent with the numbers. So no one better to run through this presentation for us. Nikki Lemeshka is the program manager as well, and she will jump in as Summer requires and needs with questions at the end. And just as a reminder, the question and answer period at this time will still only be limited to commission members. But if you have a public comment or want to comment or question on this, you can put that in the link for the public comment section and get called on. All right, Summer, take it away.
Are we sharing the screen?
Sorry, had a little technical glitch. Give me just 1 second.
Okay.
Sorry about that, everyone.
Okay, so good morning. I'm Summer Abdelmageed, the Family Violence Data Analyst. Thank you for the opportunity to speak to you about what we've been working on. Like April said, typically I would be presenting with Carolyn Brooks, our Fatality Review Project Coordinator, but she is out with COVID, so we will certainly miss her. This is a brief overview of some data that will be published in our upcoming report, as well as some of the future directions that we're headed with our project. First, let's set the scene. How much family violence is happening in Georgia, and what does that look like over time? This gives us a big picture view that we can then develop questions, compare and analyze data, and find possible explanations and strategies for addressing the issue of family violence. Our goal with anyone we are speaking with is to increase their confidence and competence in what family violence is and how to address it within your role. Throughout the presentation, the NIBRS incidents, the family violence incidents we mentioned, that will cover all of family violence, whereas when we talk about DV-related fatalities, those are only intimate partner relationships. Okay, so when we look at this graph, I think it's very noticeable, the big drop off between 2017 and 2018. From 2013 to 2017, there's a consistent trend of about 60 to 65,000 incidents per year. And then from 2017 to 2018, the entire state switched from Uniform Crime Reporting System to NIBRS. That's where we see a 20K drop off in family violence incidents reported. While the NIBRS system does provide more detailed information about crimes, the implementation phase was not without its wrinkles, and as a result, there's missing or incomplete data in the ensuing years. However, you can see the trend between the two timeframes is consistent. Family violence crimes are not going drastically up or down. They're staying consistent year to year within each reporting system. So the 2018 to 2021 data we just looked at, compared to the previous reporting period, shows a 28% decrease in the family violence incidents reported. However, we know from other reporting sources, such as DV programs and fatal incidents, that family violence has not just decreased significantly in Georgia. In fact, domestic violence fatalities rose over 70% during the same period, and DV shelter saw a 20% increase in crisis calls from 2020 to 2021. If we only looked at the one stat, the family violence incidents reported, we might be tempted to say, hey, family violence crimes are down, that's great. But when we zoom out and look at the context, we see that that would be an incorrect conclusion and potentially dangerous, considering that we all know that more resources are needed in our organizations. The decrease in reporting is due to tech changes, the change from UCR to NIBRS. Okay, so a more accurate reflection of what is happening in Georgia with family violence incidents can be seen by looking at the number of incidents per 100,000 people, or the per capita rate. This is a measurement that helps compare different county statistics on a per person basis. On this map, the darker colors represent counties with a higher rate of incidents per 100,000 people than the lighter counties. From here, we can start to ask questions about how your county compares to the state average or other counties. So weapons, children, and substances are all factors that influence a family violence situation and what police action is taken when they arrive. What effect might they have? Firearms are present in 2% of incidents, but we know that they are the most used fatal weapon, whereas hand and fist is the most common weapon used, but is rarely the fatal weapon. So which weapon do you think was more influential in whether an arrest was made? The arrest rate did go up for firearms more than hand and fist, but there was only a 7% difference between the two, which seems a little bit disproportionate when you think of the lethality increase. 63% of all incidents reported had a child as a victim, 4% were primary victims, meaning they were the target of abuse. And substance use decreased about 10% overall between the two reporting periods, but what stayed the same is that the majority of substance use in incidents is by the abuser, not the victim. So first, Georgia is not a mandatory arrest rate. Officers have discretion in determining whether or not to arrest someone in a reported incident of family violence. Best practice is an arrest, but that's only occurring in about a third of all incidents. If an arrest is not made, the officer chose one of the other 5 options: citation, mediation, none, other, or separation. There's been a 3% increase in family violence arrests statewide between the 2013 to 2017 and the 2018 to 2021 periods. There are more nuanced changes when you look at the data on a county level, however, and that's where all of you come in. How does it look in your specific county? Like we said, arrest is considered best practice. However, it's only occurring in about a third of all incidents. In this map, the lighter the color, the higher the arrest rate, the darker the color, the lower the arrest rate. Looking at the map, is anyone surprised by where their county falls in the distribution? The arrest rate increased between the two reporting periods, so the numbers are headed in the right direction. However, you can see by the shading of the counties that the arrest rate is significantly different from county to county. Why? The laws are the same, so what practices are in place in each county that may be contributing to a higher or lower arrest rate? We talk a lot about firearms due to the outsized impact they have on family violence incidents that turn fatal. 78% of the deaths from 2018 to 2021 were caused by firearms. So even though the number of incidents with a firearm is small, the impact is monumental. Does the distribution of where firearms are present surprise you in any way? Do you see any patterns that stand out to you? Something that stood out to us when we were looking at the county level data with the 2013 to 2017 comparative analysis report was that less densely populated counties tend to have a higher percentage of incidents with firearms present than more populous counties. So next we'll look at family violence services accessed by victims. Looking at that gives us an idea about those individuals who may or may not have reported the violence committed against them to the police. We know that not all DV is reported to the police, and there are other avenues of assistance. We plan on looking into perpetrator services such as FIPS in the future and to get a better understanding of that side of the equation. We are working on gathering data and will include that information in a coming report. This data shows that the overwhelming number of victims are women, about 225,000. Another 30,000 are male and female teens and children. To put it another way, adult male victims account for 15% of all victims served by domestic violence agencies in Georgia, meaning that 85% of victims served are women, teens, children, or had an unknown gender or age. However, when we look at the proportion of family violence victims, when we look at the incidents, it's a little bit closer to about 30% male, 70% female. So we're seeing that the family violence services is skewing. It's about half the percentage of the number of male victims we see in the incidents. So this map shows where FIPS are throughout the state. FIPS are specifically designed to intervene with perpetrators of intimate partner violence. In FIPS, violence is viewed as a learned behavior that is primarily motivated by desire, whether conscious or unconscious, by the abuser to control the victims. Violence is seen as one of many forms of abusive behaviors chosen by abusers to control their intimate partners and family violence. In Georgia, there are 100 FIP programs, 169 certified FIP facilitators, and 335 FIP group classes. The group classes are offered in a physical setting and virtual platforms. The groups are typically categorized as men's, women's, LGBTQ+, or law enforcement professional group. The darker colors represent more FIP programs present, and the lighter colors represent fewer programs present. So as you can see in the map, the FIP programs are very concentrated in urban areas and some areas, but most of the map is white. There are no FIP programs currently serving that county. So the number of ex parte and stalking TPOs issued between the two reporting periods increased by 22%. Although the per capita rate of TPOs only increased by 1%, the ratio of TPOs to incidents changed significantly. From 2013 to 2017, there was 1 TPO for every 4 incidents of family violence. And from 2018 to 2021, this ratio is closer to 1 TPO for every 2 incidents. What does it mean that there are more TPOs? How might you have a conversation with your agency about it? Are TPOs given out like candy? No, that's definitely a myth. Seeing a higher ratio of TPOs per family violence incident is an indicator of increased victim safety and offender accountability. Also, this ratio varies greatly in different parts of Georgia, which we're going to see next in a map. So like we said, the state as a whole had about a 1-to-2 ratio of TPOs to incidents. Each county is varied in its TPO practices, which leads to differing outcomes in Georgia. You can see on the map here that the southwest region of Georgia has very few ex parte TPOs granted, while the northeast region has a much higher numbers. This map shows extension rates of the ex parte orders. So we know that longer term orders are good for victim safety and offender accountability, but we don't always, you can see the map looks a little different here. It's not like the counties that have the most TPOs also have the highest extension rate. So we want to know, like, what are the practices that lead to a higher ex parte TPO, but a lower extension rate. We all know that family violence is serious and that people are impacted on a daily basis by intimate partner violence. Do we know just how high the stakes are? There were 695 total known fatalities from 2018 to 2021. That averages out to approximately 174 fatalities a year in Georgia. That's pretty close to one every other day. And that count is only going up as more cases are verified and added to the data. The trend of DV-related fatalities and DV murder-suicides has increased significantly over the past 10 years. What you see on this chart here is the total known fatalities in dark purple. Light purple shows how many of those fatalities were by firearm each year, and below are the murder-suicide fatalities, where we see an even closer relationship between firearm and fatalities. More than 90% of murder-suicide fatalities are by firearm each year in Georgia. To bring the loss of life from murder-suicide incidents into even starker focus, there was a 76% increase in murder-suicide fatalities from 2020 to 2021. Right now, with our 2022 data, we are on track with 2021. There have been 26 known DV-related murder-suicides from January to August 2022, accounting for about 49 fatalities. These patterns we see are our opportunities as a system to do better and prevent this upward trend from continuing. Also, there's no consistent way to accurately measure how many DV-related fatalities were prevented. So before we get to be disheartened by these numbers, remember that the majority of family violence incidents do not end in fatalities. Please take a moment and reflect on the reality of the issue of family violence. Let it sink in. We spend a lot of time as professionals working on the issue. That is good. We can't dwell in the pain of every story. That would be debilitating. But taking a moment to allow space for the pain of the loss can help us remember the core of why we all participate in this work. People's lives and stories are important. These victims had theirs ended too soon. They are loved and missed.
Thank you for that. We're going to move now into staff updates. We have got, I think they're going to be oral reports on all of these. First, an update from the Family Violence Task Force.
Judge Whitaker, I think there's still a few more slides remaining.
Sorry.
Okay. So Katie was 30 years old when her boyfriend shot and killed her. She leaves behind an 11-year-old son, Zayden. Josiah was 2 when her mother's boyfriend shot and killed her while attacking her mother. He wasn't legally supposed to be able to possess a gun. Officer Desai was shot and killed in the line of duty responding to a domestic violence call. More law enforcement officials' line of duty fatalities occur in DV responses than any other type of call. Tammy is one of many murder-suicide cases from 2021. Her husband shot and killed her, her 21-year-old daughter, April Williams, and then himself. Their 3-year-old daughter, Jamie, is left with no parents and a tragic family story. Each of these fatal cases provide information vital to preventing another fatal incident from occurring. Over the past year, we've worked with multiple task forces talking about state and local family violence response, and how the data can inform what we are doing. These are some of the responses by task force members answering the prompt. I plan to use what I learned today too. So thank you for being here with us today. I'm sorry that I had to kind of really run through that presentation to give you guys an overview of a little bit of everything. Please let us know if you have any questions.
All right, thank you, Ms. Abdelmageed, and I am so sorry to have interrupted that prematurely. And we're going to turn now to Ms. Selden, I believe, for the Family Violence Task Force update.
Good morning, everyone. I'm Stacey Selden. I'm the Family Violence Coordinator with the Commission, and I'm going to provide you with the task force report. I'm going to talk a little bit about the activities the task forces did during Domestic Violence Awareness Month in October. Those activities were both in person and virtual. You have a report of the exhaustive list of the activities, but I'm just going to give you some highlights of what some task forces did. A task force conducted the Chutes and Ladders exercise, which many of you may be familiar with. Another task force had Tough Conversations on Domestic Violence Dialogue event. Another task force did a symposium. There was an International Domestic Violence Resource Fair, an economic abuse training. Another task force completed a survivor series where they had a wide range of survivors come and speak to the community in the task force. They did a teen dating violence lunch and learn, and then also a virtual 5K to end domestic violence. So those are just some of the events that were happening all over the state in Georgia. So big shout out to our task forces for making those happen. So I'm just going to give you also some task force notes for the year end. This month and next month, task forces will begin submitting their end of the year surveys, which recap their accomplishments and challenges, and they can also make requests to me for technical assistance. They'll also provide their meeting information so I can update the directory for 2023, and that directory is located on our website. We are also working to bring training to task forces on actually what a task force is, but also task force development and conflict resolution in groups. So we're going to be bringing that training to task forces statewide, and that's slated for early 2023. Georgia has also been invited to participate in the Coordinated Community Response National Peer Network. That's going to meet monthly beginning in January 2023. I'm really looking forward to that. I'll be able to kind of dialogue and brainstorm with people around the country who work in CCR as I do. So I will keep you posted on that. And then as always, I'm going to give you the list of the following circuits that don't have active task forces. I'm always trying to work in those circuits to get a task force started. So when I list the circuit, if you hear a circuit that you're familiar with or you have some contacts in that circuit, please do not hesitate to reach out to me. My information was emailed to you, and it's also on our website if you need to contact me. But the following circuits currently do not have task forces, and that's Atlantic, Doherty, Middle, Oconee, Patala, Paulding, Rome, South Georgia, Southwestern, and Tallapoosa. Thank you.
All right, thank you. Appreciate that. And let's move now to get the updates for the FVIB programs. And I believe Ms. Ferrell, you're going to be handling that for us.
Yes, thank you.
Thank you.
Thanks. So again, y'all, I'm Jamila Ferrell. I am the FVIP supervisor at the commission. So Nadej and I are going to tag team this report. So I'm just going to give you all a little bit of the overview that we've done of training since the conference. During the time of the conference and right before, in September, Men Stopping Violence conducted the Dating Dilemma training. It was the Dating Dilemma, how systemic gender norms impact modern day relationships. And that training was a success. It was a 3-day training and 12 attendees, completed the 3 days. In October, we conducted FIP Basics and 13 attendees completed that training. The next one won't be until February. So if anybody is seeking certification or as a facilitator or just need a refresher, the registration is on the website. And we will be putting some more training opportunities up for our FIP providers. So that's all I have to report on the training. So I'm gonna give it to Nadesh.
Good morning. My name is Nadej. I'm the FVIP coordinator. In November, the team was a guest speaker at the Hall County Task Force to explain community partners, the role of the FVIP Family Violence Intervention Program, the challenges that judges have with ordering FVIP, especially in rural areas where none exists. In January, many FVIP providers and facilitators will need to recertify. Many providers and facilitators have started submitting recertification applications. Currently, the FVIP team has recertified 7 facilitators and 5 providers. There are 43 facilitators and 70 providers with certifications expiring in December of 2022. And the FVIP team has sent reminders that they must recertify on January 1st. The team will work diligently to ensure all are certified before the expiration deadline. In October, one in-person administrative audit site visit was conducted. As a result, one notice of deficiency was issued to the provider. 2 non-certified programs providing FVIP classes were reported to GCFV. GCFV reached out to the programs to inform them that they were operating outside of the statute for family violence intervention programs in the state of Georgia. The FVIP team is working with the legal department to draft cease and desist letters to these programs. The FVIP team is diligently revising the FVIP rules to submit for review by the FVIP subcommittee. The team is also working to revise FVIP basics and develop new trainings for FVIP providers. In 2023, the team will begin the next rounds of judicial circuit meetings to discuss the challenges, successes, and best practices of FVIP. And that concludes my report.
Thank you. And Ms. Abdelmageed, are you going to be giving us also a family violence fatality review data enhancement project report separate from your community spotlight update?
Yeah.
Okay.
Yeah. So for fatality tracking, fatality review liaisons statewide continue to provide feedback on DV-related fatality cases for 2022. There have been 99 fatal incidents and 136 known DV-related fatalities so far. We have 68 cases and 65 fatalities, however, that we are currently tracking to determine whether or not they were DV-related fatalities. As for reports, the Family Violence by the Numbers Statistics and Trends in Georgia report based on 2018 to 2021 data is under review. And the 2022 special topic brief is focused on teen dating violence and has also been submitted for review. In terms of professional development, the joint family violence fatality review and supporting survivors of murder-suicide workshop proposals submitted to 4 national conferences for 2023, National Training Institute, Institute of Violence, Abuse, and Trauma, Conference on Crimes Against Women, and the National Office of Victim Assistance. For our data, this year we fulfilled 30 plus data requests for various external partners. We're in the process of analyzing 150,000 new individual family violence incident reports. Preliminary analysis has already yielded new and interesting insights into the factors that most correlate with increased lethality and specific police outcomes. We're working with the Statistical Analysis Center at CJCC to compare our new incident data with their NIBRS reports. And lastly, we continue to look into new data sources and data management systems, as well as opportunities to share more family violence data on our website so that our stakeholders had direct access to the data they need. We have conducted training on the comparative analysis report for the DeKalb Domestic Violence Task Force, training conducted on family violence by the numbers, what we know and where we should go for the annual conference, and then a training conducted for Columbia and Augusta judicial circuits on DV-related murder-suicide community response and protocol.
Thank you very much. And Ms. Elliott, we'll turn to you for an update on the Supporting Survivors of Murder Suicide project.
Thank you. Okay, so as Summer well put in her presentation, she kind of shared a little bit about the trends that we're seeing in the murder-suicide numbers, where they're continuing to climb each year with that dramatic spike we had between 2020 and 2021. And also she represented that, for this year so far, we likely won't hit the exact numbers, or at least I hope we won't hit the high numbers of 2021, but we have already far exceeded 2020 again. We're currently, as she said, had 26 completed murder suicides, but there were an additional 7 attempted to add to that, and there are even some more numbers. So those numbers are reflected as of mid-November. So we are still seeing really high numbers, generating a large number of cases and a huge number of survivors that are continuing to report that they're not getting the support that they need from their local communities that are in need of additional services. So our program is very necessary at this time. We're working with them to bridge these gaps and make these connections with their local communities to try to get them services. This is kind of representative of in the third quarter of 2022, from July 1 to September 30th. I provided hundreds of services, referrals, and support to 53 new and 15 existing survivors of murder-suicide. And with numbers like that, it just shows in a murder-suicide case how many survivors and co-victims we have for each and every incident. Additionally, with the murder-suicide fiscal year running from October 1st to September 30th, that fiscal year was over, I supported 174 survivors of murder-suicide during that time last year, which was a significant increase over our 2021 numbers, where we supported 71 survivors. So we nearly tripled the number of survivors we were supporting during that time. So we're pretty pleased with the amount of contact we've been able to make. The Georgia Murder-Suicide Response Network of licensed and trained mental health clinicians is fully up and running, as it has been for several months now, and is blanketing the state again with well-trained grief support for survivors of murder-suicide, and we're continuing to grow that project. In fact, they are nearing completion. We have another 10 clinicians that are nearing the completion of their training and will be joining and growing that network. And back in August, we officially launched the first ever murder-suicide support groups that are led by licensed clinicians. Again, this is the first of its kind in the nation. The second group started in October and actually just concluded last night. So we have had 2 rounds of the support group complete already, and the third group is in progress. So we are making good progress there. As far as really important trainings that have been completed over the last quarter, we did an in their shoes webinar for the Department of Behavioral Health and Developmental Disabilities Conference. That was really well received with a huge attendance. I provided a national lethality and murder-suicide project presentation for a national audience of in partnership with Battered Women's Justice Project. I did a similar presentation on lethality and murder-suicide for Atlanta Legal Aid, did a statewide webinar series training for them. We provided 2 QPR gatekeeper trainings. Myself and Nikki Lemeshka did this in partnership, which stands for Question, Persuade, Refer, which is suicide prevention in Macon to the domestic violence communities. I provided an In Their Shoes in-person training to the Georgia Office of Dispute Resolution at their conference. And then I co-presented with Carolyn Brooks, as Summer alluded to, a murder-suicide protocol training, which is a really intensive, long, almost half-day training to Columbia and Richmond County task forces just a few weeks ago, and it was an excellent experience. And that concludes my report. Thank you.
Thank you. And there are definitely some things to be excited about from that. So appreciate that. I'm going to ask Ms. Lemeshka to give us a report on grant programming and special projects. Thank you.
Great. Good morning, everyone. Well, as you heard last time at the last commission meeting, for those that were in attendance, I was able to present an overview of our Project Safe Neighborhoods grant that we had in conjunction with the U.S. Attorney's Office for the Northern District of Georgia through CJCC. So the report that's summarizing the project's findings I had alluded to then and hoped that I would have it for you today. It is still undergoing review for final approval by the funder to be able to publish it. So I cannot imagine a world where we won't have it by the next time we meet, but that will be published online, and I can certainly share that with you as well via email. So look for that in the coming month or so. Also, the commission, I know we've mentioned before, was one of 6 sites nationally to be awarded funding from the U.S. Department of Justice Office on Violence Against Women under the Firearms Technical Assistance Project Pilot Sites Initiative. So that we have now been oriented to that project. So we're starting to make those beginning steps towards getting this project off the ground, and we're really excited for that. We're also in the process of conducting some interviews for the position that will coordinate that project. So we have an exciting pool of candidates for that as well. Another big project that, we're nearing the end of the year here. So a lot of our grants are wrapping up before they start their new grant cycle. So our law enforcement education project, which is our law enforcement training grant, we completed training focused on strangulation. We did 4 full-day training sessions conducted between November 15th and 18th in Gainesville, Macon, Albany, and Savannah. We contracted with Alliance for Hope International, their Institute for Strangulation Prevention, to conduct the trainings. So we had 2 of the best trainers in the nation, Gail Strack and Casey Gwynn, come to Georgia, and we did this tour together. So I got to spend the week with them driving around the state. We had 192 people attend the trainings, of which 130 of those were post-certified officers. And so those participants received 7 hours of training credit. I do also just want to quickly acknowledge the partners that helped bring that training to fruition. Again, this is a full day training. For a lot of people, it required a lot of additional resources, and we were really fortunate to have some great community partners who stepped up to assist us in making sure that they worked out well in the communities. So I'd like to just extend our appreciation to Albany State University's E5 initiative, Crisis Line and Safe House of Central Georgia, the Hall County Solicitor General's Office, Liberty House of Albany, Raven County Sheriff's Office, Representative Matt Dubnik, and the Savannah Police Department. And just, Michelle Bedingfield, I know, is also on the call, one of our commission members, just to show the spirit of, how we throw these, pieces all together and try to make it work. Michelle showed up last second with stereo equipment when we had an issue there. So, I appreciate the assist there as well, Michelle, from you, as always. So really felt great about that, that training experience. I think the reviews so far have been excellent from the attendees, and, really looking for opportunities to bring that high quality training to supplement what we're already doing in state in the future. So everybody else, I think, has already touched on most of the training opportunities that we've had with regard to our special projects. So I will just wrap up my report now.
Thank you very much for that. And our training is so critical to so many people in doing the work that we all want to get done. So we appreciate that. All right, I'm going to turn back to Director Ross now for the director's remarks.
All right, thanks again, everyone. Thanks for joining us for this meeting. I'll go on and just bring it home. This team has been, once again, phenomenal this year. There's been a lot of work. Obviously, if you listen to our murder-suicide director, our project manager, our data analyst, our FVIPs, our task forces. Everyone has been working overtime to make their projects successful and to bring Georgia as close as we can to ending family violence day after day. So I'll just quickly run through a few things. I think Nikki may have touched on, we were award recipient for the Federal Technical Assistance Firearms Project, or Firearms Technical Assistance Project. And so the next time you see us, there will be an addition to our number. We are finalizing our interviews next week with approximately 7 candidates remaining. And we look forward to making a great selection and having a new warm body to help us do all this work we have. Because, we like to have that other duties as assigned, that we let people know about once after we hire them, after you get on board and you get told about that part. So anyway, we're looking forward to identifying that person and bringing her on, him or her on. The next thing I'd like to point out, just for commission members, this is just a quick announcement. We're going into next year. If you notice on the top of your agenda for this meeting, there are tentative dates for the next year as far as the commission meetings. Make a note of those. But in addition to having those on your agenda, I'll be sending out the calendar invitations like I've done this in the past year. So you'll have those sitting on your calendar in advance, but I'll also have the periodic reminders as it gets close. And then I'll be emailing us, when it's time to get materials out. And so just be looking for that, accept the calendars. And then, of course, sometimes schedules change as dates get closer. So you can RSVP or change your RSVP later if you find that you're not able to attend. I'll also say for commission members, if you have not already done so, there is a form that I will reshare with you this in the next email where you can give me all your contact information, but most importantly, you can also name a proxy, a designee who can sit in for you, who would be authorized to vote on your behalf if you're unable to attend the meeting yourself. This is a great way to avoid us not having a quorum in the event that sometimes schedules don't allow for you to be present. So if you have not assigned a designee or sent me notice of who your designee or proxy is, you'll have another opportunity to do that. But in the meantime, like I said, you'll get an email that follows this meeting so we can discuss how we're going to proceed with the business that we were not able to attend today. In the previous meetings this year, you heard me talk about the strategic planning retreat that we're planning. I'll be also sending out some tentative dates on that probably in the next month or two so that we can have, it'll be a 1-day, same day meeting. We'll come meet and leave in the same day. But it'll be just basically a day when we can get together, hopefully in person. We'll try to make a hybrid because we know we're all in different parts of the state. So sometimes it's not all possible for everyone to get there, but we'll try to have a meeting for us all to get together as a commission and do strategic planning work together. The commission hasn't done that in several years, so it's really a good opportunity to get back to that and really get aligned with our mission as a whole group. Additionally, I am still in contact with the governor's director of appointments. I know that, again, they made a round of appointments and reappointments, I think it was several months ago. And we got a couple of new members then, and then some of you were reappointed who had expired, and I think there were some left, but she wanted to do it in waves. So it looks like we may be coming up on another round of that. So if you're wondering in terms of what your status is in terms of what term you're in, we'll be working with you to find that out if necessary. But if you've already just been reappointed, you won't hear from me. The next thing, I don't know if Jamila got a chance to talk about this much. I think it came up in her report of the survey. We had a great meeting at the conference on the faith community work that we're looking to do as a commission to really kind of reinvigorate a connection between the domestic violence community and the faith community, because we know the faith community is a critical part of a victim's life oftentimes, and it may be their first point of contact when they go to seek help. But we also know that our faith leaders frequently feel unprepared or uncertain in terms of how to deal with those issues when they arise. And we want to make sure that our faith leaders in this state are well prepared and well connected and acquainted with the DV organizations that service their areas so that they can better serve anyone in their congregation that needs assistance and that they feel confident in terms of their response. So again, if you hear me talk about that, or if you just on your own, think of a faith leader that lives in your area and you want to get them connected with this work. That'd be a great way. A great thing you can do is send an email, connect me with that person. I'd love to get them involved in the group that we're putting together for faith community work with DV. All right, so just keep that in mind, and that's an ongoing thing. The next thing, we have completed and submitted earlier this year the strategic plan, the 3-year strategic plan for the commission to the governor or to the OPB, the Office of these acronyms. Why am I wrong? Office of Planning and Budget. And so I will share that with commission members in an upcoming email so that you have a chance to review the strategic plan that got submitted for our 3 years. Again, that doesn't change our ability to work and update the plan. And that's what we plan to do in the coming months when we get together as a group. So just when you get an opportunity to review that, I'd love some feedback or just make note of your thoughts. And when we have an opportunity, we will certainly work on that. One of the things I didn't get a chance to point out during the legislative report, but I'll just throw in now. A few weeks ago, some commission members, I brought some commission members into a meeting with a doctor. He used to be the director of programs for alcohol, excessive alcohol drinking. And so he actually came to GCFV with an idea to work on a policy initiative around excessive drinking issues and the relationship between that and domestic violence. He's got a tremendous amount of compelling research around the issue. We certainly know and often point out that drinking or alcoholism or substance abuse does not cause DV. And so eliminating that issue will not prevent or stop domestic violence. But we also know that substance abuse, including alcoholism, is a frequent co-occurring issue with domestic violence. And so we believe that it is certainly important to explore this issue maybe in a way that we haven't before. And Dr. Robert Brewer, former CDC director for the alcohol program, is really interested in partnering with us on that. And so I'm going to be having some small meetings, small group sessions with commission members and Dr. Brewer to give you a quick preview of what he's proposed and what he's developed in terms of research. There are new research questions that we probably need to explore before a policy idea can really be clearly formed, but I think it's an issue worth pursuing. We can't address DV in a vacuum and only look at the sole issue of what the family violence intervention programs address, ignoring that offenders may have other resource needs or other co-occurring issues that need to be addressed as well. And as a state, if we're not helping to look at that whole person in terms of their issues, then we may not necessarily be doing the best service to our victims. So that's something I think you'll enjoy when you get an opportunity to meet him. Lastly, last two things I'll mention are, one, I think we told you before that we were approved by the ICJE for some judicial training in the next year. So we have approval from them for a 6-hour online course for judges. It's for all classes of court, so for magistrate, state and superior court judges to join. We're looking forward to doing that. But in addition, we also have pre-approved hours for the conference. We're working with the National Conference of Juvenile and Family Court Judges to deliver some of that training. They have put together a proposal that we feel is going to be phenomenal. And I'll also probably be tapping some of our judicial appointees on this commission to help us with further developing our judicial training and opportunities for judges to get more training in our state. Lastly, we are working, and I think Nadej and Jamila touched this, we are definitely working hard to revise and present new rules for review for the FIT programs. That is something we'll present and go through the proper channels. I think there's a process, and then certainly it'll have to have a public comment period as well. And then approval finally would have to come from the DCS board. I think they give the final approval after we've reviewed it and done all we want to do with it as a commission. So we're really getting close. And I believe it'll be early next year by the time we're ready to move into the final phases of that project and present the rule revisions to you all. So just keep that in mind. Also, this might be more relevant for our judges and some of our folks that work in the court system. We do have an issue with rogue programs. I call them rogue because, as you know, in Georgia, the commission is the body that certifies, monitors, and recertifies family violence intervention programs. But we know a lot of other states have a different structure, and they may offer just, these online classes someone can sign up for and take some veterans intervention program, get a certificate, and then what we're finding is that some of these programs are filtering their way into Georgia and being presented in court, as viable programs to satisfy the FVIP requirement. But that is not the case. If it is not a Georgia Commission on Family Violence certified program, it cannot be operating as an FVIP in this state. So I need everyone's help. If you are aware of a program or aware of this being done, or even aware of a court that is perhaps not as well versed in the law on FVIP in Georgia and is accepting these, allowing these, or ordering these, please let us know so that we can address those programs and make sure that we're all operating in compliance. We catch them oftentimes, but more often than not, it's when someone brings it to our attention that we're able to appropriately address it. So it's just a heads up. If you see it, please let us know and allow us an opportunity to get that corrected. But other than that, I just want to wish everybody a safe and pleasant holiday season full of joy and cheer. I thank you for all the work you've done with us this year. And we look forward into approaching 2023 and doing even more work and great things. Thank you all.
Thank you, Director Ross, for all of your enthusiastic leadership of this commission and all the good work that is getting done. All right, we're going to open up now for public comment. And I believe, Ms. Ferrell, you can let us know who all has filled out the form for public comment. And I'll remind those of you who may be speaking to please limit your remarks to 2 minutes per person. Because we have some other business after this as well. And if you can go ahead and let me know who those people are, we can call on them. My turn.
Okay, I just see one in the form, and I know Karima left something in the chat about their GCFV will be, not GCFV, GCADV will be hosting Stand with Survivors Day in February 2023, and more information will be coming, but she did post information about that in the chat. And we had Tenasis Walker. Are you still here? You wanted to speak on task force availability?
Yes, ma'am. I was just having a lot of trouble trying to find task force stuff, and I was also wondering if, because it was saying about certain areas that you're supposed to be in, but in my area, I don't think there are many task force. So I was just trying to find some from any and everywhere, just so I could get the hours I needed as far as being a certified LVIP person.
Okay, so I have your information, and myself and Stacy, we'll get in touch with you on that.
Yeah,
Okay,
and I'll
thank
put my email address in the chat so you can reach out to me.
Okay,
Thank you. And any questions that are kind of program specific, I would encourage anybody to visit our website at GCFV, Georgia Commission on Family Violence. It's a great website, chock full of information, and also has contact information for our different directors of our different programs as well. So if that's our only public comment, I'm also going to now invite any commission members or any of our community partner organizations that might want to make any kind of announcement to do so at this time. All right, well, hearing none, again, the reminder of the Stand with Survivors Day at the Capitol in February that is put on by the Georgia Coalition Against Domestic Violence. And I'm not sure quite what that specific date is yet, but we will try to be getting that information out. And then commission members, if you can look for some kind of communication from Director Ross as to how we will conduct the vote on our legislative agenda, that should be forthcoming. Thanks to everybody for your time and your work on this commission and on partnering with this commission and the needs that we all are so interested in. I hope that everyone has a blessed and a safe and a joyous holiday season, and we will see each other again during. Director Ross, do you have any idea when the retreat is?
I'm
planned
expecting
for?
a spring retreat, so
Okay.
we'll be looking at end of March and into April, dates in March and April. I'm working with trying to first. We've been calling a few of the sites. Colonel Bernard shared with us some great sites and for us to contact, and working with our budget team. So coordinate.
Great.
I'm going to send several dates out and get a poll for what's going to be the best date to get as many people to participate.
All right, so we'll probably have our first quarterly meeting before then, so there'll be much more information, I'm sure, at that time. All right, so I am going to then adjourn this meeting and with thanks to everybody.
Happy holidays.